All right, nursing students, welcome. If you're getting ready for your exam on Chapter 15, you are in the perfect spot. We are about to do a high-speed review that's going to sharpen up your clinical judgment. So let's just dive right in.
This whole chapter really just boils down to this one simple question. It's not about what you know, it's about how you think, how you apply all that knowledge when you're under pressure. So let's break down those core skills that really separate a novice from an expert.
So here's our game plan. We're going to tackle this in 5 key chunks. We'll start with, what even is clinical judgment? Then we'll hit the 6 core skills. After that, we'll look at the different levels of critical thinking. Fourth, we'll open up your critical thinking toolkit, and we'll wrap up with standards and self-evaluation. Trust me, following this map is going to help you build a really solid picture of how expert nurses think.
Okay, first things first, let's lock down our main concept here. You're going to see that clinical judgment isn't just some term from a book. It is the absolute foundation of every single thing you do in nursing.
Okay, this is a huge takeaway for your exam, so listen up. Clinical judgment is not a guess, it's not a gut feeling, it's the outcome, the conclusion you reach after you've gone through a really deliberate thinking process. It's that final reasoned decision that tells you what to do next.
And here is where it all clicks. The nursing process you already know and love, well, it's basically a mirror image of the clinical thinking cycle. Your assessment? That's just recognizing cues. Your analysis? That's just prioritizing hypotheses. It's the exact same framework, you're just looking at it from a slightly different angle.
All right, now let's get into the nitty-gritty. Let's break that whole thinking process down into 6 solid skills that you will definitely be tested on. These are the action steps. This is putting critical thinking to work.
I want you to think of this cycle as the engine that drives your clinical judgment. It all starts with you spotting what's important in a sea of information, recognizing those cues, and it ends with you checking your work, asking, hey, did what I do actually help? If you can get this flow down, you've pretty much mastered the heart of this chapter.
So how do you get good at this? Well, it's not like flipping a switch, it's a journey. So let's look at the 3 levels of thinking that you're going to move through as your career grows.
This is such a great way to see your own growth. We all start out at the basic level, right? We're following the rules, looking for that one right answer. Then you start to level up to complex, where you see there are alternatives. But the goal, the end game, is commitment. That's where you're not just reacting, you're anticipating needs, and you're taking full ownership of your choices.
Okay, so what do you actually need in your mental toolkit to do all this? Let's break down the stuff you need to think critically when you're on the floor and the pressure's on.
Your critical thinking really stands on these 4 pillars. What you know, your knowledge base. What you've done, your experience. How well you do it, your competence. And this is a big one for exams, your professional attitudes. That last one, that's the mindset that steers everything else. Let's really dig into these attitudes because they're so important. We're talking about having the confidence to act, the discipline to be thorough, and yeah, even the willingness to take a calculated, evidence-based risk for your patient when it's the right thing to do.
And it doesn't stop there. We're talking about having the curiosity to always ask why, the integrity to admit when you've made a mistake, and the humility to know when you need to ask for help. These aren't just personality traits, you know? They are absolutely fundamental to keeping your patients safe.
Okay, last big piece. How do you actually measure your own thinking? And maybe more importantly, how do you get better? This isn't something that just happens by accident. You've got to work on it.
So you're going to measure your thinking against 2 big benchmarks. Think of it like this. Intellectual standards are all about the quality of your thinking. Is it clear? Is it logical? Then you have professional standards. Those are the rules of the road you have to think within. Does your thinking line up with your legal and ethical duties?
Now this is a practical tool I really want you to start using like right away. It's the REFLECT model. After a really tough shift, or hey, even a great one, walk yourself through these steps, recalling what happened, examining how you responded. Trust me, this structured process is exactly how you turn that raw experience into real expertise.
If you only remember one single thing for your exam, please make it this quote. Critical thinking and the nursing process, they are not 2 different things. They are 2 sides of the very same coin. You literally cannot do one without the other. They are completely 100% interdependent.
So, as you're hitting the books, I want you to ask yourself this question. Which of those attitudes are you going to focus on developing first? Is it going to be humility? Maybe curiosity or discipline?
Because consciously working on these mindsets, that's what's going to take you from being a good student to being a truly great nurse. You've totally got this. Good luck.
All right, welcome to your high-yield review for the nursing assessment exam. We're going to cut right through all the noise and focus on the absolute must-know concepts that are going to make a real difference for you. Let's get right into it.
Okay, let's kick things off with a single most important idea from this whole chapter. Seriously, this one concept will completely reframe how you think about assessment. This question right here is the key to unlocking a higher level of clinical judgment, so let's break it down.
First things first, we've got to build our foundation. We need to understand the why behind every single assessment you do. You know, it's not just about collecting data or ticking off boxes, it's about what you do with that information that truly matters.
So here's the crucial point. Assessment is not a passive activity. You are actively thinking, you're anticipating risks, and you're constantly prioritizing based on what's happening with your patient. That, right there, is the difference between just collecting data and truly assessing a patient.
Okay, so with that foundation in place, let's build on it by looking at the specific tools you're going to use. I want you to think of this next section as us stocking up your mental toolkit for gathering really high-quality information. Think of these assessment types like different tools for different jobs. You know, a great way to remember this is to think of them like camera lenses. You use a wide-angle lens for that big, comprehensive head-to-toe assessment when a patient is admitted. But then you switch to a zoom lens for a focused assessment when you're zeroing in on a specific problem, like abdominal pain. And an emergency assessment, well, that's like hitting the record button on an action cam. You're just focused on the ABCs. Now, this is an absolutely critical distinction for your exam, so you really want to lock this one in. It's simple. Subjective is what the patient says. Objective is what you observe. So, I feel dizzy, that's subjective. A blood pressure of 90/60, that's subjective. You need both to get the full picture. And remember, the patient is your primary source, of course, but, and this is a big but, they are not your only source. Putting together a complete picture requires some real detective work. Family can give you crucial context, especially if the patient is confused, and the health record. That reveals the patient's history before you even walk into the room. All right, now that our toolkit is packed, let's focus on the most active skill of all, how to actually talk to your patient to get that high-quality information. This is where the real art of nursing shines through. I want this quote to really sink in. Before you even think about asking a single question, remember this. Building trust is the absolute key to getting an honest, complete story from your patient. Because without it, you're just collecting fragments of information. You know, every successful interview follows this logical flow. It's a roadmap that keeps you on track, it makes sure the patient feels informed and respected, and it prevents you from missing crucial pieces of the puzzle.
Now, this is a classic exam topic, so listen up. To get the best data, you should always start your interview with open-ended questions. So instead of asking a simple yes or no question like, is your pain sharp, you ask, tell me more about the pain. See the difference? This invites the patient to tell their story, and you'll get a much richer, more useful answer.
Backchanneling, it sounds kind of fancy, but it's actually so simple and so powerful. These small prompts, saying uh-huh or go on, show that you're engaged, and they help you gather more detailed info without interrupting the patient's flow. It basically tells them, hey, I'm listening. Your story is important. Okay, now probing. This is what really separates the beginners from the experts. When a patient says something general, like, I just don't feel right, your ability to probe for the specifics is key. You gotta ask, what do you mean by not right? That's how you get to the real issue. So we've gathered all this info. Now what? Well, now we have to organize it and verify it. This is the part where you take all that raw information and transform it into a clear, coherent clinical picture. I want you to think of this list as your blueprint for building the patient's story. This isn't just some random list you have to memorize. It's a systematic way to organize your data. It helps you spot patterns, identify what's missing, and communicate clearly with the rest of the team. You absolutely need to know these components for your exam. Okay, validation. This is huge. This is your safety net. So picture this. Your patient swears they took their blood pressure pill, but their reading is sky high. That's a huge red flag, right? You need to validate that information. Do they actually take it? Is it the right dose? You always have to ask yourself, does this data make sense? Do I need to double check it before you make any clinical judgment? All right, let's bring it all home. If you remember nothing else from this chapter review, I want you to burn these 3 points into your brain for the exam. These are the big ones. First up, assessment is a thinking process. It's not just a to-do list you check off. You are constantly analyzing, interpreting, and deciding what to do next. Second, how you connect with your patient directly changes the quality of the information you get. It's that simple. If you build trust and you actively listen, you will get better information every single time. And number 3, validation is your best friend. It's your safety net. Don't just collect the data, confirm it. This is how you prevent errors and make sure your judgments are built on a solid, accurate foundation. And really, that's the core of nursing assessment. It's not about having all the answers. It's about constantly asking the next right question. Your thinking never stops. If you can master these concepts, you'll be well on your way. You've got this. Good luck on your exam. All right, let's talk nursing exams. If you've got one coming up, you're in the right place. We're about to do a super fast, high-yield review of nursing diagnosis to make sure you have the fundamentals absolutely locked in. Ready? Let's do this. So here's our game plan. We're going to kick things off with the absolute must-know, the difference between a medical and a nursing diagnosis. Then we'll get into the nitty-gritty of how you actually think through and write a solid diagnostic statement. After that, we'll cover the different types of diagnoses and, super important for your exams, how to dodge the common mistakes that trip people up. Finally, we'll see how it all comes together in a real patient's care plan. Okay, first things first. This is the foundation for everything else we're going to talk about. I can almost guarantee you're going to see a question on this, so let's make it crystal clear. So what's the big difference? It's actually pretty simple when you break it down. A medical diagnosis, that identifies the disease. Think pneumonia, diabetes, heart failure. It's about the pathology. But a nursing diagnosis, that's all about the patient's human response to that disease. We're talking about how they're experiencing it, their pain, their fear, their trouble breathing. So one treats the illness, the other treats the person. And this example with pneumonia just makes it so obvious. Look, the medical team's focus is on the left. They diagnose pneumonia, they see the evidence on the x-ray, and their goal is to treat that infection. But us, we're looking at the right side. We see the patient struggling to breathe. We see the restlessness, and boom, we diagnose impaired gas exchange. Our goal right here, right now, is to make their breathing better. It's the same patient, but we're looking through 2 different and equally vital lenses. All right, so now that we know what it is, let's talk about how we do it. This section is all about getting that clinical brain working, learning how to think like a nurse and go from a jumble of symptoms to a sharp, accurate diagnosis. I want you to put on your detective hat here, seriously. Step 1 is data clustering. That's you gathering all the clues. You take the signs, the symptoms, what the patient's family is telling you, and you group all the related pieces together. Then comes step 2. Data interpretation. You stare at those clues, at those patterns, and you ask yourself, okay, what's the story here? What is all this data telling me? Okay, this next part is huge. Once you've figured out the problem, you have to write the statement, and there's a formula for this. For your exams, for your clinicals, for your whole career, you just have to know this 3-part formula. It's non-negotiable. Part 1 is the diagnostic label. This is the what. It's the official name for the problem, like acute pain or anxiety. And the key is, you're not just making this up. You're pulling it from a standardized list, like NANDI, so that every nurse everywhere is speaking the same language. Second, you've got the related factors. This is the why. What's causing this problem? And listen up, because this is probably the most crucial part. The why has to be something that nursing can actually fix or influence. We have to be able to do something about it. And the third part is your defining characteristics. This is your proof. This is the as evidenced by piece of the puzzle. It's where you list the specific signs and symptoms, the clues that made you choose that diagnosis in the first place. And this is why that related to part is the absolute engine of your care plan. Check this out. We've got 2 patients, patient A and patient B. They both have the exact same diagnostic label, anxiety. But for patient A, the anxiety is related to their upcoming surgery. So what do? We educate them. For patient B, the anxiety is related to losing their job. Is education going to help there? No. We need to get social work involved. See? Same diagnosis, but the why completely changes what we do. It's everything. Okay, another thing you've got to know is that not all nursing diagnoses are about a problem that's already here. You're going to be working with 3 main categories. First, you've got your problem-focused diagnosis. This is for an issue that's happening right now, like acute pain. Second is a risk diagnosis. This is for something that hasn't happened yet, but could, like risk for fall. Our job here is all about prevention. And third, you have a health promotion diagnosis. This is the awesome positive one for patients who are motivated and ready to level up their health, like readiness for enhanced nutrition. All right, let's talk about avoiding mistakes. This section is where you can really shine on an exam and, more importantly, keep your future patients safe. Knowing where people go wrong is the best way to make sure you always get it right. So, where do things go wrong? Well, it can happen at any step. You might miss a key piece of data when you're assessing. You might group unrelated symptoms together when you're clustering, or you might just jump to a conclusion based on one symptom without seeing the whole picture. The key to avoiding all this is just to be super thorough and methodical.
So, to keep your diagnoses sharp, accurate, and professional, just follow these 4 golden rules. 1. Always, always focus on the patient's response, not their medical diagnosis. 2. Find a cause that is treatable by nursing. 3. State the patient's problem, not what you need to do. And 4. Keep your language objective and professional. No judgment, no blaming. All right, let's bring it all home. Because getting the diagnosis right, that's not the end of the story. It's just the beginning. It's the launchpad for creating a truly effective and personalized care plan.
In the real world, patients are complicated, right? They never just have one thing going on. And that's where a tool like concept mapping is a total game changer. It lets you draw out all of a patient's diagnoses and literally connect the dots. You can see how their pain is affecting their mobility and how that's affecting their mood. It helps you see the whole picture and figure out where you could make the biggest difference. And really, it all comes back to this one idea. We have to remember that we're not just diagnosing symptoms on a chart. We are diagnosing a human being. This quote says it all. Our work is to accurately represent the patient's real, lived experience. That's where the science of nursing meets the art. So I'm going to leave you with a challenge for your next clinical day. Don't just look for diseases. Actively search for the human responses to those diseases. What new patterns, what new connections will you see now? Because making that shift in your thinking, that is the secret to mastering nursing diagnosis. You got this. Now go ace that exam. All right, are you stressing about your nursing fundamentals exam? Don't. You are in exactly the right place. Today, we're going to tear into Chapter 18, Planning. We are going to break down everything you absolutely need to know to crush those questions on the nursing process. Let's dive in. So, you've done your big assessment, you've gathered all this patient data, and now, what? How do you actually turn all that information into a powerful roadmap that's going to guide that patient to recovery? That's the whole ballgame. We're not just talking about paperwork here. We're talking about the core strategy you'll use to get your patient from A to B. Okay, here's how we're going to tackle this. We've got 5 sections. First, the foundation. Then, setting priorities. After that, we'll define what success even looks like, choose the right interventions, and finally, bring that plan to life. If you stick with me, you'll have a super solid framework for any planning question they can throw at you. First things first, let's talk about the foundation. Before you write a single word of a care plan, you've got to get in the right headspace. This is not about filling in boxes on a form. It's all about activating that sharp clinical judgment. So, what's in this toolkit? For your exam, you got to remember these 5 pieces. Of course, it's your knowledge, the science, the best practices, but it's also about being super realistic about the hospital environment. Can you actually pull off your plan with the staff and the stuff you have? It's about using your experience to see patterns and, this is huge, knowing when you're in over your head and you need to ask for help. And of course, it's all built on professional standards and driven by the right attitudes. Being creative, taking ownership, and always, always putting the patient first. Okay, so our thinking is framed, we're ready to go. What's the very first move? We prioritize. You're going to have a bunch of nursing diagnoses, but you can't tackle everything all at once with the same energy. You have to decide what matters most right now. And here it is, a golden rule for your exam. Listen up. You will always prioritize problem-focused diagnoses, the what's wrong right now stuff like acute pain, over those wellness diagnoses, which are more about promoting good health down the road. Just think about it this way. You have to put the fire out before you start remodeling the house. This is the secret sauce to correctly answering all those which patient do you see first questions. And this is so important. Please do not fall into the trap of thinking that the to-do list the computer spits out is your set of priorities. No way. Real priority setting is an active, brain-on process. You have to constantly be reassessing your patient's condition, the timing of their treatments, and deciding what is the most critical thing to do at this very moment. Because trust me, priorities can and absolutely will change. So, you know your priorities. The next question is, what does winning look like? This is where we get into defining our outcomes. We're essentially putting a pin on the map and saying, this is our destination. Okay, here's a term you absolutely have to know. Write it down, nursing sensitive outcome. Why is this such a big deal? Because this is how we prove our worth. This is the hard data that shows the direct impact our nursing care has on patient results. Things like preventing falls, managing pain effectively. This is how we show the world the incredible power of quality nursing. This slide here shows you exactly how it all connects. See, we take our NANDA diagnosis, that's the official problem statement, and we link it directly to a NOC outcome. So if the diagnosis is acute pain, the outcome is going to be pain level. But look closer at that indicator. It's not just less pain, it's patient reports pain at 3/10 or less during ambulation. That super specific measurable detail, that's what your exam is going to be looking for. So how do you write a rock-solid outcome every time? Just follow these 4 simple rules. 1, it has to be about the patient, not about you. 2, it's got to be measurable, something you can actually see, hear, or count. 3, it needs a time frame. By the end of your shift, by discharge, be specific. And 4, it has to be realistic for this particular patient. That's it. Use this as your 4-point checklist and you can't go wrong. All right, we've set our priorities, we've defined our goals. Now it's time for the action plan. These are the interventions, the specific things we are actually going to do to help our patients hit those goals. For your exam, you have got to be able to tell these two apart. It's a classic question. Independent interventions are things you, as the nurse, can do on your own authority. Think patient education, positioning for comfort, that kind of stuff. Dependent interventions, on the other hand, require an order from a provider, like giving a prescription medication or putting in an IV. Know the difference. Okay, so there are a million possible interventions out there. How do you pick the right one? You basically ask yourself these 6 questions. Will this action help me get to my goal? Does it actually address the cause of the problem? Is there research to back this up? Is it even possible to do this here? Will my patient actually agree to this? And finally, do I personally have the skills to do it right? That is your 6-point checklist for picking the perfect intervention. This quote right here from your book's Key Points just sums the whole thing up perfectly. You don't just throw things at the wall to see what sticks. It's a systematic process. If you can explain why you chose an intervention using these 6 factors, you are going to absolutely nail those questions on the test. Okay, last section. Let's talk about how all these pieces come together in the real world. Because a plan is pretty useless if it just sits in a chart, right? It has to be a living, breathing document that guides the whole team. Now, I know what you're thinking. The detailed care plans and concept maps you do in school can feel like a ton of work. But what you're really doing is building mental muscle. You're learning the why behind every step. In the real world, the electronic health record is going to streamline a lot of this. But that critical thinking process you're learning right now, that is exactly what you will use to make those digital plans work for your actual patient. And remember, a plan is only as good as its communication. We use tools like clinical pathways and EROS protocols to guide our care. That's enhanced recovery after surgery, by the way. But those are just templates. We still have to tailor everything to our individual patient. And the most important communication, a solid handoff report to the next nurse and knowing when it's time to consult an expert. Both are absolutely vital for patient safety. So here's the bottom line. Planning isn't just a task. It's a dynamic skill. It's about critical thinking and adapting on the fly to your patient's needs. To really make these concepts stick, I want you to take a second and think about this question. Think about a real patient you've taken care of. What was their number one priority, and how and why did that priority shift over time? If you can answer that, you are well on your way to mastering this material. You've got this. Now go ace that exam.
All right, if you're prepping for a nursing exam, you know those implementation questions can be tricky, right? They're designed to trip you up because they're not just about what you do, they're testing your judgment. So, in this explainer, we're going to build the perfect playbook to help you absolutely crush those questions.
Okay, here's our game plan.
We've got 6 key areas to cover. We'll start by busting a common myth. Then we'll get into the essential tools every nurse needs. After that, we'll dive deep into the critical thinking part, how to prep for any procedure, and the difference between direct and indirect care. And of course, we'll wrap it all up with the key takeaways you've got to know for exam day.
So let's kick things off with the number one trap I see students fall into on exams. It's this idea that implementation is just, doing tasks. But that's not what the test is about. It's designed to see if you understand the thinking, the coordination, and the safety checks that go into every single action. So is nursing implementation just about following orders? Let me be super clear. Absolutely not. And getting this right is the key to passing your exam. If you just think of it as a to-do list, you're going to miss all those questions that are really testing your clinical judgment, your coordination of care, and your critical role in patient safety.
To implement care safely and effectively, you need a standard toolkit. You can kind of think of these as the rules of the game. They're the evidence-based resources that guide your actions and make sure every single patient gets the same high-quality, consistent care.
Now, these tools, they're not just some papers you read once and forget about. They are active guides for your daily practice. You've got your broad clinical guidelines, specific care bundles, and even pre-approved standing orders for emergencies. Altogether, they form the bedrock of safe, evidence-based nursing care.
First up, we've got the Clinical Practice Guideline. The best way to think about this is like a roadmap for a common health issue, say managing diabetes. It's built on solid research, and its whole purpose is to make sure that no matter which nurse is on duty, the patient gets the benefit of the best approach we know.
Next is the Care Bundle, which is a really brilliant idea. What it does is take a handful of critical, evidence-based actions for a specific problem, like preventing an infection from a central line, and it groups them all together. The logic here is powerful. When you do every step in the bundle, every single time, you seriously improve patient outcomes by making sure no critical steps get missed.
Now, standing orders are all about speed and safety. They're basically pre-approved instructions for specific situations, like if a patient develops chest pain. But here's the crucial part for your exam, so listen up. A standing order never, ever replaces your own clinical judgment. You have to assess the patient right then and there to make sure that order is still appropriate and safe.
And finally, there's the Nursing Interventions Classification, or NIC. Honestly, the easiest way to think about it is as the universal translator for nursing actions. It gives us a standardized language so that an intervention, like wound care, means the exact same thing no matter where you are. And that is absolutely vital for clear documentation, care planning, and even for research.
Okay, so we've covered the tools. Now let's get into the thinking. This next part is, I would argue, the most important section for your exam. Why? Because implementation isn't just about doing stuff. It's about the clinical judgment that happens behind every single one of those actions.
Your critical thinking in the moment isn't some kind of magic. It's really a mix of these 5 things. It's what you've learned from books, combined with your real-world experience, all shaped by the environment you're working in, and guided by professional standards and, of course, the attitudes you bring to your job.
Really? The core mental work of implementation is this constant balancing act. On one side, you've got the care plan, what was supposed to happen. And on the other side, you have the actual patient in front of you, what you see right now. Your job is to constantly ask yourself, does the plan still fit the person?
All right, lean in for this one. If there is one thing you take away from this entire explainer, this is it. It's the golden rule for your exam. If a patient's condition changes, any change, a new symptom, a drop in blood pressure, an unexpected reaction, your first action almost every single time is to reassess, stop, assess, and then decide what to do. Don't just keep going with the old plan. That's a classic exam trap.
Okay, so you've done the critical thinking, you're ready to take action. But wait a second. Safe implementation actually starts before you even walk into the patient's room. Think of this next part as your pre-flight safety checklist, because good preparation is what stops errors before they happen.
This 5-point check should basically become muscle memory. Have you thought about your time and how you'll sequence tasks? Is all your equipment there, and does it work? Do you have the right people to help? Is the environment safe and as free from interruption as possible? And, the big one, is your patient actually ready, comfortable, and safe? Nailing this checklist is a giant leap towards safer practice.
Let's break down 2 categories that you will definitely see on your exam: direct versus indirect care. You need to know that both are absolutely essential for good patient outcomes, but they look pretty different in practice.
You know, the difference is actually really simple. Direct care is all that hands-on, face-to-face stuff you do with the patient. Indirect care is all the critical work you do behind the scenes, away from the patient but for the patient, to manage their care and keep them safe.
So what counts as direct care? Well, it's pretty much everything you do with a patient. It could be as basic as helping with daily activities, as technical as a complex dressing change, or as vital as teaching a patient about their new medication. It's all the visible, hands-on parts of nursing.
Now, indirect care is just as important, even though it happens away from the bedside. This is the work that makes direct care even possible and safe. We're talking about proper documentation, talking with doctors and therapists, managing the environment, delegating tasks. You get the idea. Without solid indirect care, the whole system just falls apart.
We have covered a ton of ground, so let's lock in the most important points for your exam with a quick final review.
This quote right here just sums it all up perfectly. If you go into your exam questions thinking of yourself as a professional who uses continuous judgment, not as a robot on autopilot just checking off tasks, you are already halfway to the right answer.
Okay, let's nail this down. Here are the must-knows for your exam. Number 1, patient changes? You reassess first, always. Number 2, preparation is everything. Time, equipment, people. It prevents errors. Number 3, your standard interventions, those guidelines and protocols, they're your safety net. And finally, number 4, remember that implementation is a two-sided coin. Direct, hands-on care, and all that crucial indirect work behind the scenes.
And that's a wrap. So as you take all this and head into your next study session or clinical shift, I want you to think about this. Which of these skills are you going to focus on next? Is it your time management, your patient teaching, your ability to anticipate complications? Pick one thing, because that's how you really turn this knowledge into instinct. You've got this. Good luck on your exam.
All right. Hey, everyone, and welcome. So you've got a big exam coming up, right? Well, you are in exactly the right place. Think of this as your high-yield crash course, a deep dive into mastering the evaluation chapter. We're going to skip all the fluff and get right to what you absolutely need to know to ace those questions.
Okay, so here's our game plan. First, we're going to talk about why evaluation matters so much. Then we'll build out your toolkit and walk step by step through the core process. After that, we'll get into the nitty-gritty of measuring outcomes and, what to do when things don't go according to plan. And you're definitely going to want to stick around for the end. I've got a killer exam tip that'll make a huge difference. All right, let's kick things off. Section 1. Why does evaluation even matter? Look, it's so much more than just the last step in the nursing process, something you just check off a list. Honestly, it's the brain of the whole operation. It's where all your critical thinking really comes to life. I mean, this is really the bottom line question, isn't it? How do you know if the care plan you've worked so hard on is actually working? It's not enough to just do things. On your exam, and more importantly, at the bedside, you've got to prove that what you're doing is getting results. And here's the textbook definition, but let's break it down. The key word here is judgment. Evaluation is an active, ongoing process of you, the nurse, looking at the data and making a call. You're constantly asking, are we on the right track here? Is this beneficial for the patient? And based on that, you decide, do we keep going? Do we tweak things? Or do we scrap it and try something new? That's the power of evaluation.
Okay, moving on to Section 2. To make those big judgment calls, you've got to have the right tools in your toolkit. And no, I'm not talking about stethoscopes or anything like that. I'm talking about what's inside your head, the essential ingredients for solid clinical reasoning.
This is so important to understand. You've got two things working together here, knowledge and experience. Knowledge is your foundation, right? It's what you learned from your textbooks, knowing the patient's condition, their baseline, what to expect. But experience, that's where the magic happens. It's what helps you pick up on those super subtle changes over time and connect the dots. You start to see, when I did this intervention, the patient responded in this way. You need both. They're a team.
So how do you know if you've succeeded? Well, you need a standard to measure against. Think of your expected outcomes, the goals you set back in the planning phase, as your finish line. That's your target. And the attitude you need to have here is crucial. Be a detective, not a cheerleader. Don't just assume your interventions worked because you did them. You have to stay open-minded and demand proof. And that proof comes from cold, hard, objective data. All right, now we're getting to the absolute heart of this chapter. This is the step-by-step process that exam questions are going to hammer you on over and over again. Seriously, if you can internalize this mental model, you'll be in great shape. And here it is. This 4-step process is pure gold. Write it down, screenshot it, do whatever you need to do, because this is the logic you'll use. First, you look at the goal. What were we trying to achieve? Step 2, you look at what actually happened. What's the patient's real response? 3, you compare the two. And finally, step 4, you make the call. Did we meet the goal, partially meet it, or did we miss it completely? It's a simple flow, but it's everything. Okay, so we've talked about the what and the why. Now let's get practical and talk about the how. How do you actually get the data you need to make that judgment call we just talked about? This is a super important distinction, so listen up. Evaluative measures, things like vitals, observations, asking the patient questions, can look exactly like the data you collect during an assessment, but their purpose is totally different. You're collecting this data after you've done an intervention for one reason and one reason only, to see if it worked. It's all about tracking that progress. And this table here shows you exactly what I mean. You don't just go in and collect random data. Your measures have to be specifically chosen to match your outcome. If your outcome is erythema reduced in 2 days, your measure is going to be inspecting the color of that pressure injury every day. If the outcome is patient denies breathlessness, you're going to observe them while they're ambulating. See? The measure has to directly inform you about the outcome. Now, you are 100% going to see this on your exam. NOC, which stands for Nursing Outcomes Classification. Don't let the name intimidate you. Just think of it as a standardized library of outcomes and indicators. It's a system that helps make sure everyone on the healthcare team is on the same page, speaking the same language, and measuring success in the exact same way. So let's see how this actually works. You can't just write a vague goal like improve sleep in a care plan. I mean, what does that even mean? How do you measure it? NOC forces you to get specific. So instead of just sleep, your indicator becomes something measurable, like hours of sleep or sleep pattern. Same thing with anxiety level. You can't just guess. You look for concrete indicators like restlessness or facial tension. It's all about turning these big, broad goals into stuff you can actually see, measure, and document. Okay, but what happens when things don't go as planned? What if your evaluation shows that the outcome wasn't met? Well, this is where the real critical thinking kicks in. This isn't about failure. It's a pivot point. It's a chance to reassess and get it right. You know, exam questions just love this kind of scenario. They'll give you a whole story about a patient who isn't getting better and then ask you that one critical question. So, what's your next move? Your ability to systematically work through a revision of the care plan is a massive part of what they're testing. And here's your checklist for what to do. The most important thing to remember is that you go back to square one. You don't just randomly pick a new intervention and hope for the best. No, you reassess. You ask yourself, was my initial diagnosis even right? Was the goal I set unrealistic from the start? Or were the interventions just not a good fit for this patient? You work your way through this, make your changes, and, this is huge, you document everything so the entire team knows what's going on. Okay, we have covered a ton of theory. But now, let's make this super practical. I want to give you a powerful, actionable tip. A little secret weapon you can use to break down literally any evaluation question you're going to face on that exam. And here it is. I call it the 4-point evaluation note. It sounds simple, and it is, but it is an incredibly effective way to structure your thinking when you're staring down a tough practice question or trying to figure out a clinical scenario. And look how this perfectly mirrors the clinical reasoning process we've been talking about. For every single practice question you do, I want you to quickly jot this down. Step 1, what was the expected outcome? Step 2, what was the actual patient response? What's the data? Step 3, make your judgment call. Met, partially met, or not met. And step 4, plan your next move. What would you revise or do next? I'm telling you, if you do this consistently, it forces your brain to think like a nurse, and you will see your scores on these questions go way up. You know, this quote really says it all. I want you to burn this idea into your brain. Evaluation is not the end of the line. It's not the last chapter of the book. It's the engine that powers the entire nursing process. It's what launches the next cycle of critical thinking, of reassessing, and of providing even better care. So, I'm going to leave you with this challenge. How can you use this 4-point evaluation note to study for your next exam? Seriously, try it. Take that little strategy, apply it to just 10 practice questions tonight, and watch how it clarifies everything. Thanks so much for joining me for this review, and I wish you the absolute best of luck on your exam. You've got this.
Welcome to this explainer. We're going to do a super fast review of infection prevention and control. The whole point here is to get you ready to absolutely crush that upcoming exam.
Okay, let's jump right in. Think of this as our mission, our game plan. We're going to master breaking that chain of infection. First, we'll look at the blueprint, how these bugs actually spread. Then, we'll identify our targets. After that, we'll talk about the tools we have to stop them in their tracks. We'll also cover how to protect our patients. And then, tie it all together into a solid plan so you can walk into that exam feeling confident.
All right, first things first. We have to understand the enemy's playbook, right? So don't think of an infection as just one thing happening. It's actually a whole sequence, a chain of events. And the cool thing is, if you disrupt just one of those events, the whole thing just falls apart.
And this is it. This is the famous chain of infection. Seriously, picture 6 dominoes lined up. They all have to fall in the right order for an infection to happen. So for your exam, and honestly for your everyday practice, your #1 job is to look at a situation and ask yourself, okay, which one of these 6 links can I knock over? Which one can I break?
Okay, this is a super important difference, and you'll definitely see it on your exam. Let's talk infection versus colonization. With an infection, the bad guy, the pathogen, has invaded, it's multiplying, and it's actually causing damage and making you sick. But with colonization, well, the germs are there, but they're just kind of chilling. They're present, but not causing any trouble or illness. Big difference.
So every infection kind of follows a story, a timeline. First up is the incubation period. This is the sneaky part, from when you're exposed until you feel that first symptom. Then comes the prodromal stage. Pay attention to this one. This is when you feel kind of off, with vague symptoms, but you can be super contagious. Then bam, the illness stage hits, and you're in the thick of it with specific symptoms. And finally, you get to convalescence, which is just the fancy word for recovery.
Okay, so let's zoom in on the first couple of links in that chain. We're talking about the infectious agent, the bug itself, and the reservoir, which is basically where it likes to live. So what exactly is a reservoir? Think of it as the pathogen's headquarters, its home base. It's where it hangs out, survives, and multiplies. And in a healthcare setting, man, these places are everywhere. We're talking about the hands of healthcare workers, the patients themselves, equipment like stethoscopes and BP cuffs, and yeah, even the surfaces in the environment.
All right, now let's talk about the link where we, as nurses, have the most power. And that's the mode of transmission. This is our chance to be the hero. It's all about stopping those germs from traveling from one place to another.
And here it is, the big one, the most crucial point. If you take away only one thing from this whole review, let it be this. Unwashed hands are a massive highway for germs in hospitals. The single best way to break that chain? Good, proper hand hygiene. It is, without a doubt, our #1 weapon. Period.
Okay, so when we're talking about stopping germs from spreading on equipment, we have to know what we're dealing with. Let's start with critical items. These are the things that are going into sterile parts of the body. Think surgical tools, catheters, implants. And for these, it's non-negotiable. They absolutely must be sterile. No exceptions.
Next up, we've got semi-critical items. Now, these are things that touch mucous membranes, like the inside of your mouth or nose, or skin that isn't intact. So we're talking about things like endoscopes or breathing equipment. They need at the very least high-level disinfection, though sometimes they're sterilized too.
And last but not least, non-critical items. This is the stuff that only touches healthy, intact skin. Your classic examples are blood pressure cuffs, stethoscopes, bed rails. You get the idea. And the rule here is simple. They need to be disinfected between every single patient. It's that simple.
Okay, this table right here, this is your cheat sheet for transmission-based precautions. These are the big guns, the extra layers of defense we pull out for specific bugs. So you can see for contact precautions, think MDROs, those nasty multi-drug-resistant organisms, you need a gown and gloves. For droplet, like the flu, you need a surgical mask. And for airborne, like TB, you need the heavy-duty N95 respirator and a special room. This tells you exactly what PPE you need to grab.
Okay, pop quiz time. Let's put this into practice. A patient is admitted with influenza. You know you're going to use standard precautions, but what else do you need? What kind of isolation is required? Yep, you got it, droplet. This is exactly the kind of quick thinking you need for your exam.
All right, let's move on to the final link in the chain, the last domino, the susceptible host. This is our patient, and our job here is to basically build up their defenses, make them stronger and less likely to get an infection in the first place.
And how do we do that? It's not always with high-tech stuff. It's with really good fundamental nursing care. I'm talking about things like regular bathing and good oral hygiene, making sure they're drinking enough to flush out their system, encouraging patients who can't move much to cough and take deep breaths. It might sound basic, but these actions are absolute powerhouses for boosting the body's own defenses.
So, as a nurse, you've got to be a bit of a detective. You're always on the lookout for risk factors that make a patient more vulnerable. So, think about their age. The very young and the elderly are more at risk. How's their nutrition? Do they have chronic diseases like diabetes? Are they under a lot of stress? Or are they on meds like steroids that could knock down their immune system? All of these are huge red flags.
All right, time to bring it all home. Let's build our strategic plan. This is how you're going to look at those tricky exam questions and know exactly how to assess the situation and prioritize what to do first.
One of the first forks in the road you'll hit during your assessment is this. Is the infection localized or systemic? Is it just in one spot, like a wound that's red, warm, and swollen? Or has it gone rogue and is now affecting the entire body, causing things like fever, fatigue, maybe even sepsis? The answer to that question is a total game changer.
To really understand what's going on, you've got to ask the right questions. Be specific. Do you have any devices, like an IV or a catheter? Have you traveled anywhere recently? What medications are you taking? Anything like steroids that might affect your immune system? Tell me about what you normally eat. Are your symptoms getting worse? These pointed questions will help you uncover those hidden risks.
Okay, so we're at the end. As you get ready to walk into that exam, I want to leave you with one final, powerful question. When you see a complex scenario on the test, what's the first question you should ask yourself to cut right to the chase and win this fight against infection? Here it is. Always ask yourself this: which link of the chain of infection can I break the fastest? That's it. That is the heart and soul of infection control. No matter what the question is, no matter what the scenario, start right there. If you focus on that, you're going to do great. Good luck.